This month's Voices Together series focuses on our partners at Grounds for Health. Since 1996, Grounds for Health has been improving the cervical health of women in coffee-growing communities. Their teams work directly with government counterparts to build local capacity for education and awareness about HPV and cervical cancer, and offering screening and treatment campaigns and advocating for women's health in the communities they support. Grounds also partners with coffee cooperatives and other local nonprofits to ensure more women gain access to life-saving care.
Grounds for Health sets up locally based, culturally adapted programs in coffee communities so that the very women who pick the coffee cherries that become your cup of morning coffee are kept healthy.
In 2025, Grounds for Health fully transitioned away from visual inspection with acetic acid to HPV self-sampling as their primary screening method, following World Health Organization recommendations. HPV self-sampling allows women to test themselves more comfortably for the types of HPV which are known to cause cancer. If positive, women will undergo a clinical exam to look for signs of precancer, which is immediately treatable in the vast majority of cases. This is extremely important for rural coffee farmers and their families. Screening can reach more women and communities can stay healthy and informed.
Comparing the two, the visual inspection of the acetic acid and the HPV, this is more accepted by the women. Simply because this thing, the HPV self-test, they are testing themselves. But this, after talking to them, reassuring them that there's no pain, they accept it and we are having a high number.
I feel when I come to that woman who doesn't have the knowledge, who doesn't know that there's that test that goes around, and maybe I get a positive case and I'm able to even refer and treat, I feel it is breathtaking because I know that in future I've prevented something that might be that may be tiresome to treat, cumbersome to treat, and even emotionally draining. So I feel once I do this, it has a positive impact on my side. These activities are very important to farmers because we are able to reach them at their working areas, because most of these mothers or women, you find that they are too busy in their farms, so they don't get time to come to the facility for the test. But when we reach them to where they are on the ground, we are able to test, and it is very important because some of them are not even enlightened about the test.
Thank you very much. We are now at the Jet Catholic Church, where we are collecting HPV self-sampling today and tomorrow. And the HPV self-samples, when we collect them, we shall take them to Karatina for testing. After the testing, we shall bring back the results. For those who are HPV positive, we are going to treat them. For those who are HPV negative, we shall tell them that the HPV tests were negative and they're required to be rescreened after 5 years.
Cervical cancer is entirely preventable, yet it will kill hundreds of thousands of women this year. What is needed are two things: global resources and implementing organizations like Grounds for Health who know how to get this work done.
Between their past projects in Central and South America and current programs in high-burden Ethiopia and Kenya, Grounds for Health has screened nearly 238,000 women and provided treatment for almost 20,000 women. Grounds for Health is on the global stage as an organization that continues to innovate in order to reach more women and make sure the highest possible quality of care is achieved. TogetHER is proud to call Grounds for Health a partner and a member of our network of cervical health champions. You can learn more about Grounds for Health at groundsforhealth.org. For more Voices Together entries, visit TogetHER's website at togetherforhealth.org.